I expect to see all the great things that industry is doing and the private sector is doing to help us move towards universal health care.
The panel is quite international and I'm looking forward to outcomes.
Tonight we explored the shared responsibility of all stakeholders in making universal health coverage a reality. As we concluded in last year's event, we still have to do more, to do better, and we need to do this together.
I don't think there is anyone here who has not got health services from a private sector provider, or taking a private sector product, or consider a private sector doctor or nurse. Private versus public is an unhelpful discussion. There is one health system with different players, different roles, and I wanted to add different interests that need a publicly led, responsive, regulatory and legal framework that governs towards equitable access to health with financial protection.
In Europe, we spend 1,500 billion euro every year on healthcare. 300 billion of that money is wasted. That's 1.5 times the medicines budget, just to give you an idea. What needs to be done is to make sure, together with the other stakeholders, that you understand where the efficiencies can be gained to make the system sustainable.
In Kenya, insulin, a vial was retailing for about $18, but when we streamlined the supply chain, it came up to about $4 to $5. It's through government initiative and support that we were able to tackle the supply chain issue.
I think we need to be not dogmatic but open-minded to tap financial resources and accept that one size fits all may not be the solution. If we really want to make progress on the triple billions, we have to be open-minded in how to achieve these goals.
City Cancer Challenge really encourages all the stakeholders to come together and listen to actually what's required on the ground.
I have had the extreme privilege to be treated in a hospital where 85% of cancer patients survive. A hospital 20 kilometers away with the same condition, 60% of patients survive. So the question is, you need this data to be able to assess afterwards, what is this hospital that has 85% survival doing that the other one is not doing?
Data for us is critical, but it's very important on who owns the data and who collects the data.
We really are talking about universal health coverage, then it's all. And all means those who offer medicines, those who have palliative conditions, those who have curative conditions. So the conversation will be broadened when we are really able to do some clear unpacking.
I did engage governments in actually a private-public partnership. The way we packaged our approach to government, it has to be shared value, it has to go beyond the cost, but at the same time we have a social and an environmental bottom line.
From a pharmaceutical industry point of view, from the private sector point of view, we are passionate supporters of universal health coverage. Because if we don't make progress, we will never reach the no one left behind. It is important that we have a business model which is sustainable, which works, and we need to engage.
I'm inspired by the words that were exchanged, the conversation.
I think it's great that the dialogue's moving. I think tonight's been a good example of that.
I would encourage more such discussions in countries as well so that you have a more holistic solution.